I'm sure you're here because you want to understand why you are having a crack, sore, tender, chapped, or bleeding nipples. Why does this happen? Let me reassure you that you are at the right place. Out of 100% of women, 80 to 90% of women would experience one of these tendency. This is very common, and you might have a different experience because we are all different and unique in our own ways. You can experience this while breastfeeding because it's going to take time for you and the little one, or you and your baby, to acclimate to the new experience. I've been there myself. Soreness is stronger in the beginning and tends to subside as you continue to breastfeed your baby. These are some of the signs that you can notice when you're having sore, tender, or painful nipples. Sensitivity to touch, aching, tenderness, throbbing, and burning. In some cases, you may notice swelling of your nipples, redness of the nipple. I experienced all of this because my experience was different. It was so painful and I was almost teary whenever I was breastfeeding my little one. But trust me, you're going to get over it after listening to my few tips. Now let me talk about why do we have chapped nipple. During nursing and pumping, the skin can become irritated and then chapped from the constant chapping involved in this process. Why do we also have crab, scaped, bleeding, and fused nipples or painful nipples? This means there is too much strain on your nipple tissue, which may leave your nipple to be vulnerable to infection, bleeding, scabbing tissues, painful nipples, cracked nipples, referring to the sore tears that may occur after breastfeeding. I had this experience. It was so painful. Like, there were moments that when I want to breastfeed my little one, I will have to take a deep breath, look at him, feed him into the breast. The moment he grabs the nipple and starts to breastfeed, I will no longer feel the pain, and I know you can be able to hold on to this. It is a beautiful experience to be a mom, to give life, and to be able to suckle your little one. Cracked nipple have few symptoms, and it may look red and dry, especially at the tip of the nipple. Mine was really reddish and it was cracked. I just want you to be strong. If you are experiencing a similar situation or you want to avoid it, the nipples may also appear flake and crusty, and nipple fissures may have scab on them as they heal. So you should not be worried about this scab. So I also have this, and not long from then I felt much better. The nipple may also feel pain, soreness, and itchy. So as we have spoken so far, these are some of the appearances that you are going to be having. Let's talk about the causes of the painful nipple while breastfeeding. So the first cause of painful breastfeeding is improper latching. That starts from the first day or from the first moment you start to breastfeed your little one. And some of the symptoms would start to show few days after you have started to breastfeed your little one. Some of the ways that we position the baby wrongly during latching is that the baby mouth is not widely open to your areola or the dark area around your nipple. Another one is baby suck forcefully on your nipple. So what is the second cause of painful nipple during breastfeeding? Nipple also pain during a bad lash. It might sore, it might scape, and it might chapped. Let's talk about the best positioning that you need to take during breastfeeding. Don't reposition yourself where you are sitting. Look for a comfortable position and make sure that you are properly seated to avoid moving or shifting from your current sitting position. To make sure that when you look at your baby, there should be this imaginary line running down from their ears, shoulder to their hips. So that means your baby is well positioned. The next thing you're going to pay attention is touching your baby's lower lips with your nipple in order to stimulate the rooting reflex. So right now I'm going to be talking about the different breastfeeding positions that you can apply. So the first one I'm going to mention is the football position. This one was a little bit hard for me. I tried to do it, like it was kind of like a bit tricky, but it might go well for you. And then the second breastfeeding position that I tried using was the sideline position. I use this a lot because I had back pain, so I could not sit up for long. The other breastfeeding position that was one of my favorite was the laid back position, or the biological nursing. There's also the crossover positioning for breastfeeding. There's also the cradle positioning. You could breastfeed your baby using the cradle positioning. If you cannot tolerate the pain and the pain is too much, you should contact your healthcare provider in order for them to get you maybe a pain relief, or to see if there is a further need, which was what I did. I contacted my healthcare provider because the pain that I was feeling was not going away. So I was given a barrier cream to be applying on. Another cause for a painful nipple would be an engorged breast, and I think that was one of the reasons that I also have this painful nipple. My engorged breast can happen during pregnancy. It means that you're producing a lot of breast milk, or while breastfeeding you are producing a lot of breast milk. This can cause the nipple to stretch and crack. The use of breast pump can also cause painful nipple or fissures nipple, especially if the setting of the suctioning is too high. This could lead to painful nipple soreness and fissures of the nipples. And also with the breast pump, if the breast shield is not the right one, it can also cause painful nipples. So in this case, if you don't know the right breast pump to use, you can contact your healthcare provider or talk to the lactation consultant. They will be able to refer you to the right breast pump to use. I tried to contact a lactation consultant to see if I could use breast pump because I was having this pain, because I wanted to do exclusive breastfeeding, but they encouraged me that I could still continue to breastfeed. I've already explained to you all the things that can cause breastfeeding, tenderness, soreness. And if you are already breastfeeding or you're an expectant mom, I'm sure you'll be able to avoid this. And one of the other things that you can do if you have already started experiencing these feelings, you just need to keep on breastfeeding. The pain is going to go away in a few weeks, few days. Let's now look at some of the remedies, what you need to do in order to help your tender, sore, cracked nipple or bleeding nipple to heal fast. If you're trying to clean your nipple, just use plain warm water. You can also apply express colostrum or breast milk on the sore or cracked nipple. It's going to help with the pain. I also did that and it worked for me, and I'm sure this is also going to work for you. Another thing to do is by using breast pad. So this is to protect your nipple from friction from your bra. And it's also advisable to avoid breast pad made from plastic because it can trap moisture, and this moisture can tend to cause breast tenderness or breast soreness. So one of the best barrier cream you can get over the counter is lanolin, or the purified lanolin, which is the most recommended for breastfeeding moms. And you can also use coconut oil. I also made use of Vaseline. That was one of the advice given to me by my healthcare professional. So you can also use some other vegetable oil, but you have to make sure before applying any of this barrier cream, you can seek advice from your healthcare professional. But lanolin, I think, is recommended for everyone unless you have a specific medical condition or this is causing you any after effects. So the next, soothe it by cooling. You can get relief from this sore nipple or painful nipple. And you can also use warm compress. If the cold compress did not work for you, you can use warm compress. I used to use the warm pad. It was giving me the relief that I needed at the moment. You can also avoid moisture nipples by making sure you air dry your nipple, because moisture can cause tear of the nipple. So you can also massage your engorged breast. If your breast is too full and you see that your baby, it will be difficult for your baby to latch, you have to either use the breast pump to express some breast milk, or you can either use your hands to gently massage the breast so the baby can properly latch. And also, if you notice that you are having an infection such as thrush or mastitis, you should contact your healthcare provider, who will be able to provide you with some antibiotics. Just taking care of your nipple. Make sure when you're having your bath, even while you're pregnant, do not allow soap to get into your breast, because it can cause the breast to dry out, and this will definitely cause nipple to break. Make sure you apply barrier cream while you are pregnant. You can use simple coconut oil each time you want to have a bath. If you're pregnant, make sure you clean your nipple with normal warm water. But you can as well ask your healthcare provider for the best option in order to avoid breaking nipple or sore or tender bleeding nipple while breastfeeding. Thank you so much for watching this video to the end. Please do not forget to click on the subscribe button. Make sure you like this video, and if you have any suggestion, give me your thoughts on the comment section. Please do not forget to click on the subscribe button and the bell notification icon, so whenever I upload a new video, you'll be the first to be notified. Thank you so much. Love you.